The factors contributing to ovulation. Our ovaries store our entire life supply of eggs. The eggs was immature and stored in tiny fluid-filled structure called follicle.
The pituitary gland that is located at the base of the brain produces hormones that direct the function of the ovaries. Each month, the pituitary gland secretes follicle-stimulating hormone FSH and luteinizing hormone LH into the bloodstream. This hormone will reach ovaries and several hundred immature eggs will start to mature, expanding the size of the follicles. As the egg matures, the follicle will secrete estrogen, which is the main female sex hormone. Once the amount of estrogen that was released to the blood reaches a certain level, the pituitary sends a surge of LH to the ovaries, causing the most mature follicle to open and release the eggs in a process called ovulation. The free egg travels to the fallopian tube where it awaits fertilization. Eventually, the remaining immature follicles and eggs dissolve.
Factors contribute to anovulation. Anovulation is generally caused by an imbalance of one or more hormone, especially those involved in ovulation, which includes gonadotropin-releasing hormone, follicle-stimulating hormone, and luteinizing hormone. Hyperandrogenism occurs when a person with ovaries has higher than normal levels of androgen hormone in their blood, due to the increasing of GnRH level. Eggs are stored in the follicles of human ovaries. A high testosterone level can cause these follicles to remain tiny rather than growing and maturing as they should before ovulation. These follicle conditions can result in hyperandrogenism, which is polycystic ovary syndrome (PCOS). Some of the immature follicles do not dissolve and remain as a full-filled sac or cyst. In addition, the blood has a high levels of insulin, a hormone produced by the pancreas. Too much insulin combined with high levels of LH can lead to excess production of a male hormone called testosterone in the ovaries. Abnormally high levels of testosterone will prevent ovulation, which can lead to the anovulation and infertility.
Male infertility also could be the factor contributing to the failure of fertilization. Male fertility have problems to do with quantity of sperm and quality of sperm. Having the low sperm count and poor quality sperm decreases the odds of one of your sperm will fertilize with the egg. Thus, fertilization will unlikely to occur.
Next, let's see what are the strategies to overcome the problem of fertility. Firstly, if a patient has a PCOS, which is polycystic ovary syndrome, she needs to undergo minor surgical called laparoscopic ovarian drilling. Ovulation cycles may return to normal if part of the ovaries are removed. Medicinal pills such as metformin is beneficial for women that have PCOS, and clomiphene citrate that encourage the monthly release of an egg. So, ovulation is induced by inhibiting estrogen receptor. Next, injection such as follicle-stimulating hormone can be produced by the pituitary gland in the body. These hormones assist in the maturation of eggs in the ovaries of female. And lastly, in vitro fertilization. A woman's eggs are removed from ovaries and fertilized with a sperm in a laboratory. An embryo is then transferred to the woman's uterus and developed. In vitro fertilization gives a lower risk and the success rate is 70%.